Hello, doctor.
Hi, my name is Kia.
Hello, Miss Kia.
And what is your name?
My name is Chanton Tolliver.
Okay, I will be here to do your lower limb assessment today.
Excellent.
Okay, so if first you could just stand in the anatomical position with your palms outward.
Like this?
Yes, so I can take a good assessment of your posture. Okay, now if you could just march in place. And I will be doing this assessment to see if you put weight on one leg more than you're putting it on the other. And also to see if your feet or your knees go out as you are walking on a regular day basis. Okay, you can stop. And now if I could have you do a single leg squat. Okay, that's good. Could you do the other leg for me? Okay, excellent. And now if I could just have you lie on the table. Lay back to where your feet are on the table, please, and do a bridge. Okay, everything looks okay. Can I have you take one of your shoes off for me? Okay. This big bone on the inside of your ankle is your malleolus. And I'm going to touch right here. Here, if anything was wrong with your malleolus, such as a medial malleolus fracture, you would feel the pain right here. Or if you had sprained your ankle, you will also feel that right here. Okay. And now I'm going to do ASIS, which is your anterior, superior, inferior iliac spine. Can you put this leg down for me, please?
Yes, ma'am.
Okay. And in making this assessment, I'm just making sure your iliac isn't tight. And now I'm going to touch your pubic bones to make sure that they are both leveled, like at the same position on both sides. And if you come to right here. Okay. Now, would you lift up one leg? Okay, good. Can you lift up your other leg? Okay. This was the pubic bone palpation, and your pubic bone went down as your leg went up. Okay, now I'm going to have you do the Thomas test. So if you could just stand at the edge of the table with your hip above the table. Hug one leg up to your chest and fall straight back. Since this leg does not touch the table, or if you can make it touch the table even if it's by force, your Thomas test is still positive. Okay, now can I have you hold again so I can do your quadrant test? I will move your leg around and have 4 stopping points. This is to move your leg in a quadrant. And as I'm doing this, I can actually feel a pop in your leg.
Yeah, I hear it.
Okay. So since you can feel the pop, but there was no pain, that means that you are at risk or you already have a labral tear. Okay. Now, if you could put both of your legs up in a 90-degree angle. Up a little more like this. Okay. And then I'm going to take this leg and put it up. Your legs have to go up at least 20 degrees of your full flexion, because if not, that would mean that you would have tight hamstrings. Now I'm going to assess the patella. Your patella should be able to move 2 centimeters in any direction. And now for your ACL test. I'm going to take your foot and externally rotate it while feeling right here. If you were to have any pressure right there, that would mean that your ACL would be torn. And right here, when I do this and move this part around, if you were to feel any tenderness, you would have an MCL tear. And by going like this and basically rotating your calf, I am testing your meniscus. So if you were to feel any pain while I'm doing this, you would either have a meniscus tear, or there would be very little meniscus tissue on the outside of your knee. Now if I could have you lay on your side. This area of your leg right here is your greater trochanter. And if you were to feel any pressure or any tenderness while I'm doing this, then that would mean that your greater trochanter is unhappy with its load. And this right here is your ITB. And same for that. If you feel any tenderness right here, then you would be at risk for either bursitis or impingement. Now I'm going to take this leg and abduct it. Could you lean forward a little more? Okay, perfect. And I'm going to let your foot go, and you need to hold it in the air. Okay. Your over test is okay. Now, if I could have you lay on your stomach. I'm going to take this leg, try to make it touch your butt, which it does not. And the same with this one. Okay, so your ELI test is positive, meaning that you have tight hamstrings because the heel of your foot does not touch your gluteus maximus.
Okay.
And now I'm doing your glutes and hamstring ratio. So if you could lift this leg up, the one that I'm touching. Okay, put it back down. Lift it up again. Okay. Now you can lift this leg up, put it back down. Lift it up again. Okay, thank you very much. Now, when I did that, I touched your hamstring and your glutes to see which one would fire first, and it is your hamstrings, meaning that they're compensating for your glutes, which means you need to work on that. Okay, your assessment is over. So as I told you, your Thomas test was positive,
Yes, ma'am.
meaning your hamstrings are not up to par. And you also had a positive quadrant test because when I moved your leg around, there was a click or a pop, indicating that you either already have a labor tear or you're on your way to one.
Thank you.